I love this question. What is the difference between implantation symptoms when you're in your 2-week wait and symptoms of low progesterone? So low progesterone in your luteal phase can come with symptoms like spotting. Usually the spotting will start a couple of days before your period. It can also include breast tenderness, irritability, changes to bowels, headaches, changes to temperature, feeling hot, even changes to sleep patterns. And yes, all of these symptoms are potentially early pregnancy symptoms as well, which can make it a little bit confusing. But there are a couple of things you can do to help rule out the possibility of low progesterone if you're having symptoms, especially if you're having a short luteal phase, especially if it's less than 10 days long, or you're having a lot of premenstrual symptoms in that luteal phase. BBT can be very helpful to just identify when you've ovulated and get a more accurate measure of how long your luteal phase is. So for implantation, you really want your luteal phase to be at least 10 days long. From the date you ovulate to the day you get your period, you want it to be at least 10 days long, ideally 12 to 14 days. If you have good, adequate levels of progesterone, then your luteal phase should be 12 to 14 days. The other thing you can do is get your progesterone levels tested. You'll need a referral from your doctor, and you want to time that for the peak progesterone, which is 7 days after your ovulation. So again, tracking your cycle will help you to time that as best as possible. Also keep in mind that early pregnancy symptoms, especially in the really early stage, like before your period is even due, tend to be very mild if they're there at all at that early stage. So if you're having a lot of intense symptoms during your 2-week waits, especially cycle after cycle, then it's likely more to do with hormone balance for you than a potential early pregnancy, although it could be. And part of it is that we tend to become pretty hyper aware of our bodies when we're trying to get pregnant and we're in that 2-week wait, right? Every little tiny twinge or mild symptom seems sometimes a little bit enhanced because we're super aware. It's not the case for everybody, but I think it's a pretty common experience. But if you're having symptoms that are affecting your quality of life, please check in with your doctor. Get some blood tests to check your hormone levels. Any questions? I'll meet you in the comments.